this program or this presentation is focused on those who want to start a telehealth program or want to have an idea of how to put together a program for either clinical purposes or educational purposes. So before we start, I just want to let you know that I do have a private practice where I practice primary care via telemedicine, remote medical care. And aside from primary care, I also do some consulting services. This is my website, yourvirtualphysician.com, and I encourage you to visit the resources tab on the website. There are a lot of resources there, including guidelines and other sources that you can read on and learn more about the stuff we're talking about. Otherwise, I have no conflicts of interests in relation to this presentation. This is the agenda for today's meeting. And again, you will see along the presentation, the slides have a extra text because this is something that I want you to keep and kind of reference later on as you continue your telehealth journey. But starting, I want to let you know that telehealth is a value-based strategy. So it's a tool that we use to improve and increase the quality and the efficiency of the services that we already provide in our practices or organization. And I like to use this equation at the bottom. Value equals the quality or outcomes over the cost of what it takes, the cost it takes to provide those services. So on the quality aspect of the equation, you can put there things like increased access to patients or for education, things like less travel, less time travel, less cost, decreased wait time, decreased missed appointments, and that sort of thing. In the cost portion of it, you can add things like decreased cost because of the telehealth program. Maybe your organization will save money because of the actual telehealth implementation, or maybe your organization might have increased revenue from the telehealth program, or it can be a combination of both. Another strategy that is using telehealth is that the telehealth program can bring so much value to the organization that the investment in the program brings more business to the organization because of the telehealth program, even if the program itself doesn't generate much revenue. So it is a value building strategy. So 2 questions to ask are, why does my organization need a telehealth program? And how would the telehealth program improve the services at my organization? And so once you decide to get going with telehealth, you need to frame the program. And the first thing that should come to mind is define what is going to be the use of the program. Is it going to be for clinical purposes, or is it going to be for educational or non-clinical purposes like surveillance, like disease surveillance, infection or disease surveillance, CME, telemonitoring, telementoring, patient support, and patient education. Another concept is define the end users. So you need to really know who is going to be using the telehealth program. And the end users are defined as those individuals who are going to be using the program after it has been implemented. So it can be your students or learners, it can be faculty or healthcare providers, the patients themselves, or even administration. Also, defining the business model is important. Are you going to put together a traditional telehealth program or a direct-to-consumer telehealth program. And the difference is that direct-to-consumer telehealth is a program that is delivered directly to the patient's home or directly to the patient's office or whatever the patient is. A traditional telehealth or telemedicine program takes place in a traditional clinical setting. In a clinical setting or traditional educational setting. So that's the main difference. Also defining the context of your telehealth program is, like I said, is it going to be a direct-to-consumer model, or are you going to be delivering your services to an outpatient setting or to an ER or urgent care setting or hospital, inpatient setting or rehab or skilled nursing facility? If the program is for educational purposes, you can also consider the same sort of context. If you're going to deliver distance learning or online learning, is it going to be delivered to the learner's home, or is it going to be delivered to an academic institution where the learner is? That would be a traditional model. And the only reason I make the distinction between direct-to-consumer and traditional is because when a program is being delivered direct-to-consumer, there are specific e-commerce issues, like legal and regulatory issues, that need to be met, that don't necessarily apply to a traditional setting or program. Another way to frame the telehealth program is defining its funding, right? Startup funding and operational funding. So are you gonna use private equity, meaning your own money, to start the program, or are you going to get a loan or have some sort of private investor give you the money for the startup, or are you going to use a grant, or are you going to use philanthropic funds to start your program? And then once the program is going, what type of operational funding are you going to rely upon? Are you going to be billing insurance to get funding, or any other payers? Are you going to bill directly to the patients or to the learners? Or, like I mentioned earlier, is your program so valuable to your organization that really the funding comes from the additional business your organization earns from having such a valuable program? So the first thing that we should look at is doing a needs assessment. And basically is identifying those service gaps or those unmet needs that your organization has. And that's really what's going to lead your planning and your designing and your development. It could be educational service gaps, it could be clinical service gaps, or administrative service gaps. And admit some other patients. So another way that you can think of a needs assessment is by looking at your end users and looking at their demographics, and then create or find those needs based on their demographics or on their social or economic circumstances, or if there are any cultural or language barriers within your patients or clients that you need to address, and you think that a telehealth program would help with that. So that's another way to look at a needs assessment. A very useful way to get started is trying to find a specific program or some other organization that is doing what you want to do already. And then you can benchmark that program and use that as a blueprint. Now, on top of those gaps or unmet needs, you should also figure out if there will be a demand for your program. So now let's say you find some need for a diabetic educational program. Will there be a demand for it? And also, will the end users be willing to fulfill the need? Will they be willing to use your program, even if there's demand? And something that is very important here is the concept of usefulness and the concept of ease of use. How easy, how useful will this program be? And that is going to encourage people to actually use the program. And I'm going to talk about usefulness and ease of use later on in the presentation. A telehealth champion, that is also really important that when you're doing this needs assessment, you need to identify within your organization who is going to be that person that you're going to call your telehealth champion. And the next slide, I'm going to talk a little bit more about that. And last but not least, you should really start finding who are those stakeholders within your organization, who are those key players that are going to support your initiative to create this telehealth program. And you have to start from the executive level, right? Administrative, management. Who are those key players there that are going to back you up? Legal counsel. Who are going to be those in the IT department that are going to help you move forward? Clinical staff. From the financial aspect of your organization, who are those persons who you can bring in and help you develop this, and so on. But that needs to start right away. You need to find those stakeholders right away. So the telehealth champion, the best way to describe it is the energy to create the changes needed to start a program, a telehealth program. These are people who are very excited about telehealth. I read this and I've always liked it. It's the glue that builds these relationships amongst those stakeholders. It provides this is the person that provides all the telehealth education, is the to-go person to find out about what's going on, what's new, what's next. And it's important to have this person because usually it's a person with broad knowledge on the topic of telehealth. He's not an expert on specific subjects, but he's a person that knows where to find the resources and who to talk to find the answers. Now that you've completed the needs assessment, then it would be important to define what your telehealth program is going to be. And it starts by defining what are the services that you are going to be delivering. So, staying with the diabetic educational program, let's say you want to create a telehealth program for diabetic education for your patients. These services that you're going to be offering will eventually become the goals and objectives of the program, and that is really important. So you really have to define right away what are the specific services that you want to provide. Define the mode of service. Like I mentioned, is it going to be a direct-to-consumer platform, a traditional platform, a live and synchronous video technology, or asynchronous? And then you need to define what are going to be the technological needs that are going to come with this program. So would you need more broadband? Would you need better hardware, better software? Start looking into those details. Also, in terms of providers, start thinking at this point, who are going to be those individuals within your organization that will provide those services, and start surveying your organization and try to find those key individuals that will help you provide those services. And they don't have to be physically where you are. These can be individuals who are in remote locations and will be able to connect remotely to help you deliver those services to your patients or clients. And also defining what are going to be the legal and regulatory constraints that your organization will have to deal with in order to make this program happen. So that's why it's important to have your legal team off the bat, have those with you to support you in this sort of definition. The next thing would be to build a business case, right? Because especially if you're talking to management, if you're talking to the, to the board and the executive level, they want to know specific information. So, for example, what are the approximate startup costs? How can you estimate that? And what are going to be the estimated operating costs? That's really important because at the end, what you want to have happen is that the program becomes sustainable in the long term. So remember that startup costs dry up pretty quick. So the startup costs include, for example, new hardware, new software, maybe an update on your broadband, consulting fees, during that startup term, legal counsel. All of that involves cost. But also you have to estimate, once you start the program, you need to estimate what are going to be those operational costs, like ongoing training, maintenance for the equipment, upgrades for that equipment, or even replacement for the equipment that you are using now, and also marketing. If you're gonna start a program, you're gonna have to do regular marketing and promotion, so you get an influx of users. Even if the marketing is within the organization, it still eats up resources and budget. So that should all be implemented there. Another part of the business case that is really important is that you have to define or determine how this telehealth program that you're putting together aligns with the goals of the organization. So if you are creating a program for diabetic education, it has to align with everything else that your organization is doing to take care of your diabetic patients. It has to flow. It can't be a burden, because otherwise then the telehealth program becomes useless. Again, last but not least, it is important to calculate or to determine what would be the estimated return on investment of this telehealth program. And the return on the investment could be, because with the telehealth program, your organization is going to save so much more money, so that you can calculate the return on the investment as a cost saving strategy. Or you can calculate it as a revenue making strategy and then estimate how much money your organization can make or will be able to make by having this telehealth program. Or a third strategy is, how can your organization become so much more valuable by implementing a telehealth program that it's going to earn so much more business from this telehealth program, even if the telehealth program does not make revenue. Right? So those are three ways to think of return on the investment. So we talked about defining the program, we talked about business case, and then the third part is designing the program and implementing the program. And this is where the meat of the planning is, and it starts by defining what are those tasks that you need to achieve or to complete in order to implement the program. So, you know, training, you know, do you need to train the staff? Do you need to find someone that is going to help you create a training program or a training course for your staff, for example? A budget and create a marketing plan to not only make your organization aware of your telehealth program, but also the community and your future clients, especially if you're planning a direct-to-consumer program. This is really important. Another task is do a survey and find out really what is the technology that you need, or whether or not you can do with the technology that you have already, or do you need to find new technologies. Then find out about those possible technologies, learn about them, and then be able to present that and see if this is something that can be used. Now, the second bullet is really important because these plays with the, you know, aligning your program with the organization. So in order to make that happen, you need to design what's called workflows or workflow maps. What is going to be the flow of this telehealth program that is going to make it work seamlessly within the organization? Again, it has to flow, it has to work. If it becomes a nuisance or a burden, then it's you know, people are not going to want to use it. So developing workflows, again, this is something that has to be done within the stakeholders. Have your team help in organizing workflow maps. How are the services going to flow within the organization operation? That's really important. Start trying to identify, as you move on, identify what are going to be possible challenges that you're going to run into as you implement this program. Are you going to run out of money, or are you going to have individuals who might ask your interest in developing a program? Are you going to have doubts or people who are going to be against the program, or you name it? So identify those possible challenges and then try to come up with ways to handle those problems or challenges. And then, you know, at this level, at this point, engage legal counsel, and as part of the design of the program, have your legal counsel team help you with regulatory issues and legal issues to make sure that things are smoothed out and everything works well. And at this point, it's also important to have your IT experts help you decide what is really the best way to invest in technology. And I'm going to make a point. I made a point of the investing in technology because it's only when, or at least it's recommended that only when you have your goals and objectives and you have your business case in place, is at that point where you should start thinking about investing in technology and buying technology. Sometimes program managers buy the technology first, and then they try to build the telehealth program around the technology, and that can be very hard. So instead, you should focus on your needs and your strategies, and then find the technology that is going to help you make that happen, make your goals and objectives happen. Very important also, make sure that once you understand your goals and your objectives, then define specific measures and metrics that are going to help you evaluate and track your program's goals and objectives, right? So what data do you need to collect and how to collect it? And that's going to help you assess whether or not you're on track. and then develop marketing strategies to help with the adoption of the program. Now I'm going to make a quick, I'm going to put emphasis on what's called adoption of technology, or adoption of technology by the end users. And it's really important that if you are starting a program for the first time, that you start small and you stay very basic and simple, and see how this initial program and this initial venture works. And this is important because you want the program to remain easy to use, and a program that is useful. And this is based on the technology of acceptance model that says or defines that programs that are useful and programs that are easy to use influence the behavioral intention of the users to actually use the program. So if you start off with a complicated program that is going to put a burden on the user, it's just going to become a barrier in itself for your end users to use it. So make sure that as you design the program, that you keep it lean, small, simple, at the same time useful, and something that is relatively easy to use to encourage adoption. And then last but not least, once your objectives and your measures and your metrics are in place, then you can go ahead and implement the program, get started, and then at this point, that's when you start collecting data. You monitor the program and how your goals and objectives are being met or are not being met. Start identifying what challenges or possible improvements are there to work on. And based on that, you can develop a quality improvement process to make the changes needed and keep improving the program. So in summary, telehealth is, like I say, is a value building strategy that is going to help your organization increase the value of what you're already doing. Make sure to recruit and engage your stakeholders early in the process. Identify that telehealth champion in your organization that is really going to help get your program going. Remember that startup costs are only the beginning. Always add into the budget, add your operational or estimated operational costs, and plan for sustainability. Align the goals of your program with the goals of your organization. Work on workflow maps and on measures and metrics for your program. Focus on usability and on the ease of use of the program to encourage adoption. And monitor and have a quality improvement process in place. And these are some of the resources that I use for this presentation. These are very well-known resources in the telehealth community. These are some of the links for you to use. This is my contact information. If any of you have any questions in the future or would like to contact me, and that's it.